I know a little bit about ulcerative colitis. Basically, I don't know a whole lot, but it is very similar to Crohn's, but it affects a different part of the body. So ulcerative colitis is, well, from what I know, it usually attacks a little bit higher up in the digestive system, so more towards the stomach, but I could be wrong. And ulcers is a big problem. That's what causes the pain. That's what causes the walls of the digestive system to become unable to absorb the nutrients. So similar to the way Crohn's does with the inflammation in the scar tissue, the ulcers cause a lot of problems. So a lot of people with ulcerative colitis have the same exact success with the whole diet thing and the bacteria balancing ideas as people with Crohn's. So a lot of the same treatments naturally apply to ulcerative colitis. So they're very similar as far as symptoms and severity. Each one of them, ulcerative colitis and Crohn's disease, both have different levels of how severe your disease is. And you can have a very mild form of Crohn's, you can have a very mild form of ulcerative colitis. Same with severe. I've seen people who have very severe forms of ulcerative colitis. They almost die. They have to receive blood transfusions. They're so sick. It can get very severe with both diseases. And the symptoms are very, very similar. It's just kind of, I'm not exactly sure how they diagnose the difference. I'm sure it's just the location and what it kind of looks like when they see it, when they actually go in and look with scopes and things like that. So just inflamed and cause pain, and it causes that layer to become thinned and really painful. So as far as I know, and it can cause blockages, it can cause the malnutrition, it can cause the diarrhea, it can cause pretty much all the same symptoms as Crohn's. So.